In today's video, I am sharing my 13th and 14th week pregnancy update. Hi guys, so as I mentioned, I am sharing my pregnancy update. I am 14 weeks and a few days pregnant right now, so I thought I would give you a little bit of an overview what happened in last week and, well, I guess 2 weeks ago, 13th and 14th week, because there were multiple things that did change in the way I'm feeling and the way my pregnancy is going. So here it goes. And that's right, if we did not meet before, my name is Yana and I am a mom of 2 boys already, 5.5, 2.5, and this is my 3rd pregnancy. And here on this channel I talk about balancing life and work and all those good things, but this is a pregnancy update because I'm pregnant and I think it's a fun thing to do, and I potentially can relate with a lot of people, and hopefully we can share a lot of experiences, and hopefully some of the things that I'm going through will be helpful to you. So just to give it a quick overview with the pregnancy, I am considered high risk pregnancy right now already because the way my 2nd pregnancy ended and because of my age. I'm 34 right now and I will be 35 at the time of the delivery. And well, first of all, 35, they will consider you high pregnancy right away. But then also my 2nd pregnancy, I was not diagnosed with anything throughout the pregnancy. However, a day before I delivered my 2nd child, I was diagnosed with either preeclampsia and HELLP syndrome, which is basically, I think, protein in my urine. Maybe, I do not actually remember. There was a disbalance in my blood and there was high, very low platelets and high something else. Oh my goodness, I need to look up or maybe ask my doctor what it was. But basically HELLP syndrome describes that. However, I have never had high blood pressure. That's why it was a little bit difficult for me to understand what was going on and like how I'm being diagnosed when a lot of the things did not match up with your standard preeclampsia and HELLP syndrome. So right now at the 12-week mark, I started taking baby aspirin because they say that if you do take it, the chances of me having that happen again lowers. Hopefully. Again, with the consequent pregnancies, there's still a chance of preeclampsia and HELLP syndrome coming back, and the internet says 20 to 80%, so it's like a huge range of percentages. So basically there is no guarantee that I will have it or I will not have it, so no one knows, but doctors suggest that I take baby aspirin starting from week 12, so I do daily. I take a 1 tiny pill of aspirin and my prenatal vitamins. The other thing that got me, well, even more concerned, the doctors are more concerned, is that I have protein in my urine and a pretty high level. When they asked me to do a 24-hour urine test because, again, of my history, and I did do a 24-hour urine test. I dropped off my specimen, and the day after or something like this, my doctor called me and he was, well, he sounded a little bit concerned, and he's like, well, he did not tell me any of the numbers what it was, but he's like, we need to send you to the nephrologist so that he or she do probably ultrasound and maybe do a few other tests, whatever. So that appointment is coming up next week, but the doctor did not tell me any numbers. And then the program coordinator called me and she told me what to tell to the nephrologist office, and she gave me the number of 1100 milligrams of protein, which I have no idea what it is. After I called my nephrologist, I went and Googled, obviously. At first it was very difficult for me to figure out what the numbers mean. I've never had anyone in my life. First of all, I don't have that many pregnant women in my life, so I don't get to talk to people in my situation a lot. So and Google was not very helpful at first, but then I saw some of the things. But basically what happens is that your kidneys get inflamed and then they start letting protein leak through into the urine, which is not supposed to be happening. It said that if it's 2 grams of protein that you have in your urine, that's a severe condition for your kidneys. And I'm like, wait, it doesn't make sense. 2 grams and I'm at 1100. What does that mean? But then like a few minutes later, I processed it. It's 2 grams versus 1100 milligrams. So basically I'm like 50% there, not exactly there. So obviously it sounds serious. I'm not exactly sure what is happening. I read a little bit more things about kidneys and how it works, and I wonder if, well, pregnancy obviously affects the way your body works, but I wonder if my diet got way worse for my kidneys versus it used to be. So I changed my diet a little bit within a few days, these past few days, and then I'm going to talk to the nephrologist in a few days and we'll figure it out. But that's the thing that basically qualifies me for being high risk, and then we're going to see how everything goes in the future. Obviously not a fun thing to discover, and at first I got really scared because like reading some of the things online, I was like, oh, it's a little terrifying. But then because I'm Christian, I just remembered a few verses. It's all Romans 8:28. I'm going to display it right here because I'm reading my Bible in Russian, so it's difficult for me sometimes to quote. But basically, for those people who love God and are called to his purpose, everything is for good. And even though from our point of view it might not look like it is, it seems like a very difficult, challenging, and very scary thing that is coming our way, it is for good. And then that day in the morning, I listened to Pastor Rick Warren's sermon, which he talked about renewing. God's mercy renews every day. And in the evening I was crying and like was so discouraged, and then I was like, oh, Yana, just don't cry, because tomorrow you just need to go to sleep, because tomorrow new mercy will begin and you will feel way better. And then again, being nervous and anxious about certain things, it's so natural for us to worry about things. However, worry does not do anything. It just steals the joy, and you basically is in this panic mode all the time, which is I feel like it's very normal for us to have it, but we really need to be careful so that our lives do not turn into anxiety and panic attack at all times. Because basically, if you cannot control it, what's the point of being nervous? You need to like think and take proactive steps to resolve an issue that has to be fixed. But being worried about things is very not productive. So it's difficult to accept and difficult to control, but that's what everyone needs to learn how to do. And again, me knowing God, it's a little bit easier. If you do not believe in God, obviously it's harder to do, but there are ways to train your brain to try not to worry as much as you probably would. And I'm so sorry, you guys, I keep touching the side of my hair because I got poison ivy. I'm not sure if you see some on my cheeks, a little bit on my arms. It is a little bit bright, but my ear is pretty swollen. I'm not going to show you, but I'm like, I don't want to show it out, so it itches too, and it's a little bit uncomfortable, but whatever. Sorry if I touch myself too much. But yes, another thing that I will have to do, because it is a high-risk pregnancy now, they did schedule 20-week appointment with my hospital, but my doctor said that he probably wants me to move it a little bit closer just to see how the baby's doing, if the development is progressing the way it should be. So I think my anatomy scan will be a little bit sooner than it was supposed to be at 20 weeks. Now on to the fun and exciting things. I'm sorry, I like jumped in onto all the scary things. I wonder if I lost people because of all the scary things I was telling you. But okay, let's go into the fun things. The baby development is 13 week. The size of the baby is a lemon, and right now at 14 week. 14th week is an orange. I'm like, oh my goodness, she's the lady on my app said a fist. I'm like, that's so big. It's incredibly large. So there's some hairs growing, some nails growing, the brain, the intestines are all developing, and it's like so fun to hear and like very, very interesting. But yes, now on to the way I'm feeling. I am definitely still feeling pretty nauseous, but the nausea strength came down a little bit. It's not as strong anymore. I don't feel like throwing up. I just feel a little bit weak and don't feel as good, but it's definitely better. My fatigue is definitely not to the point where it was before, that I like laid on the couch and couldn't move and cried because like how out of control I felt. felt. But right now I'm getting tired. There are a few moments throughout the day where I'm like, oh, I just don't have energy. I feel like laying down, and sometimes I don't get to lay down because of the toddler and life and work and everything. But it is okay. It's definitely better, and I'm like getting excited that I think it's getting better and I will have energy very soon. The next thing is that I am waking up at night, which I think is a little bit too early for my term, for the number of weeks I think it should be happening like third trimester. And currently it's not every night. I do not wake every night, which I'm very thankful for, but it's like every 3 nights I wake up like randomly at 3 o'clock, 2 o'clock in the morning, and I cannot go back to sleep. So I watch a YouTube video, go on Instagram, read a little bit, think, read my Bible, and then go to sleep around 5 o'clock or so in the morning. But yeah, it has been a little bit difficult because I mean I have to function the next day, but that's the way that goes. So sleep problems a little bit. I did get a few very vivid dreams, which I think definitely is a pregnancy thing. Again, I thought vivid dreams come later in the pregnancy, but I definitely had a few, so it's like fun. Sometimes they're very cool, sometimes they're like weird, a little scary because they're so bright and real. I do have some aches in my belly. It's weird, the feeling as if I'm gassy when I'm not. It's like that, as if it's in my intestines, but I don't think it is in my intestines because I'm not gassy. And it's the muscular pain that if I move a little bit in a crooked way, I feel it pulling more. So I kind of have to be careful the way I move and not to like rush up and not stand up too fast if I'm laying down, or not to turn around too quickly. So that's the way my belly and my muscles feel. I do get headaches once in a while. Again, when I'm not pregnant, it's super rare when I have headaches, but recently I do get a few pretty strong, like pretty sharp headaches that do not come back very often. I think I had maybe 5 or 6 days out of those 2 weeks that I had like a headache for. I mean, I would wake up with a headache and then it would go away and I will not notice when it went away, but it wasn't for too long, so that is good, I guess. Another funny weird thing is that what my breasts are doing, there are moments when I feel like my breasts are releasing milk, which obviously I do not have milk because I'm not breastfeeding. But if you have had children before, and if you have breastfed, you know the feeling of the milk release. So at first the baby sucks for a little bit and then your breast releases the milk, and it's like tickly, slightly painful feeling. It's like weird. So there are moments when I just feel it as if the milk is coming out, which obviously no. And also at the moments when I get more emotional or nervous, that happens again, which is like very normal while you're breastfeeding. So I'm kind of just curious, will I have a lot of, I mean, I normally do have enough milk and slightly more than my baby needs, but I'm like, are my breasts like getting ready to like breastfeed all the hunger in the world? And that is all, you guys. I am still wearing regular clothes for the most part. I did pull out all of my pregnancy clothes that I owned, and I will be doing a separate video about my pregnancy closet because I think it's going to be a super fun video on like a capsule wardrobe, because my whole pregnancy basically will be during fall and winter, so like all the warm things. And I don't have that much clothes that I had, and I did buy a few extra pieces to fill in a little bit, so it will be a separate video about my clothing. But yes, currently I mostly use regular clothes. I do opt in for the dresses just because they're slightly more comfortable, and I did wear maternity jeans a few times already, which is obviously fine, but I still have not fully switched to the maternity clothes because my belly is not still super huge. However, it is showing. You can see the baby, not the baby, I mean baby, and my belly popping out a little bit, and it is exciting. And now let me show you my belly. So here we go from the front. Can you tell anything? Maybe you can't. And from the side, this is what it looks like. It definitely, like, again, for people who do not know that I'm pregnant, they probably wouldn't know, but it is definitely getting the shape of a pregnant woman. So, and again, like, if can I pull it, suck it in maybe, but I definitely can, because like when I'm comfortable and just walking around, I think this is the way my belly looks. nice and small, big, I'm not sure. Let me take this off so you can see. I'm wearing regular jeans, and this is the belly. Ta-da! My belly button starts looking funny. I mean, it did not look too funny with my second pregnancy, but right now I think it does. But whatever, that's the belly. Thank you so much for watching, you guys. I hope it was fun and entertaining for you to see what's going on in my pregnant life. If you're pregnant, please leave me a comment below or message me on social media. I would love to connect with you, see how your life is doing, congratulate you on this exciting thing. I hope you're feeling well too. I hope nothing too crazy is happening with your pregnancy. But yes, or if you have any other questions about motherhood, work, balancing life and work together, so basically things that I will be sharing, things that are helping in my life to move through the life of being a work-at-home mom and not feel like a failure at all times of my life. And I share things that help me be more productive and get more things done, and share the things that are not working once in a while. But yes, you guys, thank you so much for your time, and I hope to see you in my next video. Bye bye.